How do you know if you have BPPV? I'm going to discuss this in this video and give you just 3 really quick things that you can kind of identify that's going to put it kind of up at the top of the list for you. Welcome to the Vertigo Recovery Doctor. I'm Dr. Kevin Smith, and I not only want to help you figure out what's causing your vertigo, but I also want to help you recover from it. The best way to get my help is if you hit that little subscribe button and the bell next to it to get notifications on when I come out with new helpful content. Now, if you're trying to figure out what's causing your vertigo, grab my free ebook down below. You'll find the link, or you can find it on my About page, and that'll get dropped right into your inbox if you sign up for my weekly newsletter. That has the 5 most common causes of vertigo and how you can recover from them. I'm hoping that's going to be really helpful for you in trying to figure out what's causing your dizziness. So BPPV, most common cause of vertigo, and probably one of the easiest to fix, with the exception of some of that atypical vertigo or atypical BPPV where you have more than one canal or it's a strange presentation. I do get that. But most of the time it's resolved, or I should say 90% of the time it's resolved in one visit with one maneuver. That's all you need. You don't need to do multiple maneuvers throughout the day. You just got to put those little crystals back where they go. So BPPV, within the vestibular system, within the inner ear, you have these little calcium carbonate crystals called otoconia, and those can get displaced into the canals. And whenever you change positions, so let's say you lay down, or you sit up, or you look up, or you look down, those little crystals are moving in response to gravity, right? And whenever they move, it causes dizziness and vertigo. And it causes this abnormal eye movement, or this rhythmic eye movement called nystagmus. And that's what usually creates this sensation of the room spinning. And that's why most people describe BPPV as the room spinning. I mean, everybody kind of experiences it differently, so I've had a lot of different descriptions of what people are experiencing, but I'm just going for what's most commonly reported. So that's actually one of the first things on the list of whether or not you have BPPV is one, room spinning sensation. Now don't confuse this with a head spinning sensation, because that could be a different problem. It's usually a room spinning sensation, so the environment's moving around you. So 1, is it spinning? 2, is it coming on with positional changes? So is it coming on when you look up, or is it coming on when you look down, or when you bend forward, when you lay down in bed particularly, when you roll over in bed? Now if you're only getting dizzy when you go from laying down to sitting up, that could be more of like an orthostatic hypotension or some kind of motion sensitivity, cervicogenic dizziness. We're really looking for if you get dizzy when you lay down. That is going to be more indicative that you have BPPV, or those little crystals displaced in the inner ear. So 1, is it spinning? 2, is it coming on with positional changes? And so pay attention to when you're experiencing the dizziness. And 3, is the duration of the symptoms. Is it lasting longer than a minute? So usually BPPV is less than a minute. And sometimes if the little crystals are stuck to the cupula, the little structure at the end of the canal, it can last longer than a minute. So it's possible that you could still be BPPV, but most of the time it's just floating around in the canal, and it's going to last around 5 to 20 seconds maybe. So if your dizziness is a spinning sensation, if it's coming on with positional changes, and if it is lasting less than a minute, then there's a high likelihood that you're experiencing BPPV and that you can fix it with a maneuver. Now there's 3 different canals on each side. Each one of those canals has a different maneuver. Most often you get these little crystals displaced in the posterior canal, less often in the horizontal canals, and it's kind of debated at all of whether or not they actually get displaced in the anterior canals. If you would like help in trying to figure out what is causing your vertigo, or or if you have BPPV, check out my Vertigo Kickstart mini course, where I take you through step by step on how to test for which canal is involved and the best maneuver for your specific BPPV. Remember, there's different maneuvers for each canal, and I go through that in my mini course. So if you'd like help with that, check it out down below or in my About page. So far we got that spinning, positional changes, and then we have lasting less than a minute. And the other thing that I kind of look for is, if you have another person with you, you're looking for that nystagmus, which is kind of this twitching of the eye. And when I'm testing somebody for it, I'm looking to see, is that twitching going in a specific direction that would correlate with one of those canals? And so that's how I'm diagnosing it. And I know it's going to be a little bit more challenging to determine the direction if you're not trained in looking at it. But if you see some kind of twitching, most likely, could be BPPV. The other thing I'll say is I typically look for a kind of a pattern of symptoms. So let's say you're laying down. Usually there will be a little bit of a delay, and then your symptoms will kind of start to ramp up, and then they'll peak, they'll ramp back down before completely resolving. So looking for that kind of, that pattern of symptoms is going to be a little bit more indicative of BPPV as well. So those are some of the things that you can look for to determine if you're having BPPV, and how you can know if you do have it. Some of the more atypical BPPV, it may be lasting longer than a minute. And you may if you have more than one canal, it's probably going to come on with, laying down and rolling over. And if you reposition one canal, you may have to do another maneuver to get the other canal. One side note is if you are doing some kind of, Epley maneuver at home or some kind of repositioning maneuver for the posterior canal, make sure that you're not lifting your head when you rotate. Keep your head back, because a lot of times you can reposition or what we call convert those little crystals from being in the posterior canal into the horizontal canal. So a lot of times I have patients come in that say, okay, yeah, I've been doing the Epley maneuver at home and a couple times a day, and I think it's helping. And then I test them, and they have the posterior canal, and we fix that, and then I test them for the horizontal canal, and it's also in the horizontal canal. And now I'm like, okay, well, you probably some point during trying to reposition it at home yourself converted it from the posterior canal to the horizontal canal. And this is something I go over in my mini course of how to avoid that, because then you don't want to, it makes it a little bit more complicated, and then you have to go through more than one maneuver. So hopefully avoid that. But I hope this was helpful for you in determining whether or not you have BPPV, whether or not you have those little crystals loose, and get it fixed, because it's an easy fix. If you have any questions, please feel free to reach out, and I hope this was helpful for you. Thank you for watching.